In the Shoals, there are several places where you can get tested for coronavirus. Right now, there are 4 testing locations in Florence alone. One of those places is Thrive Urgent Care in Florence.
We are joined now by Wes Hamilton, a nurse practitioner at Thrive Urgent Care. Thank you for coming on the show, and thank you for all that you're doing for our community.
Yeah, thank you. Thanks for having me on.
How is your staff doing right now, and what are some of the challenges that they face?
We're all doing well. We're all healthy. You know, some of the challenges we're facing right now within the clinic itself is, you know, early on we had to just figure out kind of how to. We sectioned off our clinic in the very beginning, so where we bring in sick people, so people with fever and cough and COVID-like symptoms in one area, and then we started bringing in what I would say non-sick patients. So that's patients that, you know, are regular urgent care patients where it might be a laceration or a fall or you know, something of that nature. So early on, it was just trying to figure out how the flow of the clinic would go and to get patients through and to keep everybody safe. Other challenges are just one thing I've noticed as far as patients go. I've noticed a lot of patients that have other health issues that need to be seeing their primary care doctor or need to be going to some type of a health care provider or waiting or not going or doing without important medication that they take. So that's one thing I've noticed over the last few weeks. So we've tried to offer, you know, telephone visits and video visits so people can actually be seen or talk to a healthcare provider to get their medications filled.
Mm-hmm. Yeah. Is it possible, Wes, to give us a percentage of positive test results from your location? Is it higher or lower than you would have anticipated?
Our clinic alone, we have done since March the 16th, we've done over 200 tests, and we haven't had a positive yet.
Wow.
So since March the 16th, we've started doing the nasopharyngeal swab, which is the COVID antigen. And then about 6 days ago, we actually started doing the antibody test, which is the blood test. And we've done several of those since last week, and none of those have come back as positive since then.
Well, Wes, thank you for your time this evening, and we certainly appreciate your service to our community.